Hi, this is Dr. Tom with Causenta. Today I'm going to talk about the effects of exercise with oxygen therapy on immune parameters in cancer patients. And I'm going to share some information that I hope you'll find as fascinating as I do. So what I want to do first is just talk a little bit about who I am and what's Causenta. And most people by now know I'm an exercise scientist, and what basically that means is I study how exercise can help improve health and fitness. And part of our interest is that when someone's dealing with a very serious health issue, is how do we help them not only beat that condition or overcome that health issue, but also get bigger, faster, or stronger, get healthier and more fit as part of their overall process. There's a lot of disconnects in medicine. One of those huge disconnects is that there's no allowance for lack of use. And what I mean by that is many times when someone is sick, medical professionals, out of concern for safety and they don't want to see anyone get hurt, they'll say, oh, be careful, don't push yourself too hard. And the consequence of that is that patients don't do enough activity to actually keep their lean body mass high and stimulate their immune system at the level it needs to be stimulated in order to fight disease. So I'm going to show you some cool things in this presentation today that are going to really open up your eyes as to, wow, I should have been doing things maybe a little differently. One of our goals at Causenta is to use exercise and nutrition to help people with all diseases to get better. And we got basically a pretty big goal for a fairly small company. And our goal is to eliminate diseases of all kinds for everyone, for all humans, I guess. And so I hope you find this as interesting as I do. And I guess let's get started. I'll show you some cool stuff. So this first slide, this is, I guess, different immune parameters that we measured. And essentially what we did is we drew some blood from someone. We had them do an elliptical exercise movement pattern. And specifically, we used a Cybex arc trainer. It was a model 772AT. The reason why we use that is they could be moving arms and legs at the same time. And in previous data, we found that we got better responses when we had more limbs moving. So rather than just moving the upper body or the lower body, if we had movement in both the upper body and the lower body, we got a better response. And what I mean by response is we got a better increase in cytotoxic T lymphocytes. And so if you take a look at this slide, you'll see that when the individual was exercising, there's like a red column that's pre, so that's right before they started exercising. Then there's a brown column that's after, that would be immediately afterwards we drew their blood. And then we drew their blood again 30 minutes later, that's the light green column. And then the blue column would be 60 minutes after exercise. And what you're seeing is the counts of the cytotoxic T lymphocytes. So on the left side of the slide, you're seeing what happens from regular exercise without breathing in added oxygen. Then on the right side of the slide, what you see now is, okay, what happens if someone does the same exercise protocol, but this time they're breathing in 86% oxygen. So this is more oxygen than would be in room air. And the difference now is you look at how much more the cytotoxic T lymphocytes increase. So for that day, they went from 53 to 208, but across from the prior treatment, it went from 142 to 208. Now the thing to keep in mind is this is the number of cells per microliter, and there's roughly 27,000 microliters in the human body. So think of those differences multiplied by 27,000 times. And now what you're seeing is like, wow, this is a pretty significant increase. And by the way, the main point here is that breathing in a higher concentration of oxygen increased the cytotoxic T lymphocytes. Why does that matter? Those are the preferred cells that fight and kill cancer cells. So this was, think of this as initial data in someone with no evidence of cancer. So now this is some more data. This is the same person. This time we're looking at natural killer cells. And basically what you see is similar responses, that when you breathe in oxygen while you're exercising, there's a dramatic increase in these natural killer cells. And one of the ways that exercise protects us against getting cancer and actually helps us to fight cancer if we already have cancer cells in our body is through these NK cells. And so the main comparison here is take a look at when there's just regular room air that someone is breathing in, the natural killer cells got to 950. But when someone's breathing in oxygen and doing the same exercise protocol, the natural killer cells get up to over 2,000, so it's 2225 exact. That's a big difference. And again, remember that difference, so 2225 minus 950, that number would be times 27,000. So that's a huge increase in natural killer cells in circulation that can go and fight cancer cells. So far, that initial data was on someone with no cancer, and essentially what we started to realize is that we started noticing that the exercise while breathing oxygen was having a significant effect for helping people fight cancer. But we were wondering, like, how is it doing this? We know the different immune cells were increasing, but what else is going on? And so we have a unique case here. This was an 88-year-old female. She had lymphoma. And on paper, her lymphoma was a type of cancer that should have been easy to treat. She saw some physicians. They gave her some chemotherapy. It wiped out the lymphoma. And it came back in about 3 months. They did it again. And basically, every time she was treated with chemotherapy, the immune system, or rather the lymphoma would disappear. But then at some point afterwards, it would come back. And so her doctor said, look, there's something going on here that doesn't make any sense, like why it keeps coming back when it disappears so quickly. So they had referred her to our center to basically do some further testing. And I did some testing on her where we looked at the microbiome in her blood while we looked at all these other immune parameters. And what we found is that she had bacteria from spiders in her blood. And so we did this exercise with oxygen protocol. And what we noticed is one 15-minute treatment with breathing oxygen while she's exercising. We found that the bacteria were eliminated. And simultaneously, what we found is that her cytotoxic T lymphocytes and her natural killer cells increased substantially. So what we learned from this is that as the immune system increases, so these are basically immune counts increasing in the blood, they appear to eliminate all kinds of pathogens that are also in the blood. And the result of that eliminating the pathogens is that now her lymphoma disappeared. She's not had lymphoma ever since. So what we think happened is that somehow the bacteria were involved in causing the lymphoma, and by eliminating the bacteria, we eliminate a vector that caused the cancer cells to form. Now, this requires more mechanistic type of testing to really confirm that, but the main outcome that everyone should take away from this slide is that she doesn't have lymphoma anymore, and her immune system is much stronger. And by the way, she doesn't have the spider bacteria anymore. So since that point in time, we've tested hundreds of people now. We've identified all kinds of bacteria and fungi and viruses and parasites in different people. And we have found that if you breathe in oxygen while you exercise, you stimulate the immune system so intensely that it eliminates all these organisms. So what I have in this slide, this is a list of all different kinds of bacteria that we discovered in people. And so basically we draw their blood, we see there's this bacteria, they do an exercise bout, we then retest them immediately afterwards and 30 minutes later, and we find that those bacteria are gone, and even when we retest them months later, there's still no evidence of that bacteria in their blood. So we think the exercise with the added oxygen is enhancing immune function to such a level that it's helping the body fight all these pathogens. So this slide shows all the different organisms as far as bacteria. This next slide shows some of the fungi, and even some Lyme organisms were also discovered that we could eliminate in a 15-minute exercise session. So that there's application for these findings to people dealing with Lyme disease. And the thing I'll point out is no added supplements or drugs were used. This is just exercise alone while breathing in oxygen. This next slide, this is a 40-year-old male that had colorectal carcinoma. This individual was diagnosed with pretty serious cancer that the doctors did not give him very much time. They said they didn't think he would live past a few more weeks. We did a bunch of immune testing measurements on him. We saw he had some immune dysfunction, and so we then got him into an exercise regimen where he was using a recumbent cycle ergometer. So basically he's kind of leaning backwards while he pedals with his legs. And then we had him breathing in oxygen. And the reason why I had him use that as opposed to a full elliptical is he had some pain while he was standing on the elliptical because of the position of his tumor in his colon. It was less painful for him to be kind of sitting and leaning backwards versus standing upright. So we accommodated, him just to reduce the pain. And what I want you to see in this slide is that even by modifying the movement pattern we were doing, he was still able to get a significant increase in different immune cells that can fight cancer. This individual wound up living 2 years past what the doctors originally thought. They thought he would pass away 2 years earlier. And one of the things that came out of this that was interesting is by adding exercise with oxygen, he was able to handle chemotherapy quite a bit more. Earlier on, he had done some chemotherapy and got neuropathy. When we added the exercise with oxygen, he was able to do the same chemotherapy, and his neuropathy was almost non-existent. And he even had some radiation therapy as well, and the side effects were minimal. So one of the things we learned is that exercising while breathing in oxygen, it actually reduces side effects associated with chemotherapy and radiation. So my point about this is at this point in time, we had learned that exercise with oxygen therapy can improve immune function dramatically. It can improve all kinds of other health markers, like help the body get rid of toxins. But more importantly, it reduced the side effects associated with FDA-approved cancer treatment protocols that typically were pretty hard on people, and sometimes they couldn't finish the complete protocol because of the side effects. In his case, the side effects were minimized. This next slide has information on a 33-year-old female with breast cancer. And this particular person was on multiple types of chemotherapy. And the main point I want to make is we're able to improve immune function for her, even though she was taking up to 4 different chemotherapeutics at the same time. Traditionally, what would happen is someone on that many different drugs, you would see their immune parameters go down. In her case, you're seeing that her cytotoxic T lymphocytes have more than doubled after 8 weeks of exercise. And again, that difference, you would multiply it by 27,000 microliters to get the global impact it had on her immune counts in her blood. And here you're seeing similar responses on her natural killer cells. Then basically, this is 8 weeks of exercise with oxygen therapy. Now, this slide here shows you the week-by-week changes. And so basically, what the main point of this slide would be is that over 8 weeks, you could see her immune cells increasing. I could tell you from experience of testing a large number of people, traditionally this would be the opposite. What you would expect to see for someone that's doing the variety of chemotherapeutic agents that this patient was on, you would see their immune markers going down. As a matter of fact, many people know that their white blood cell counts drop so low that they often have to be given other drugs to stimulate their immune cells to come back up to normal. And what I'm showing you here is that when we introduce appropriate exercise into a cancer treatment program, we're now using exercise to counter some of the consequences or side effects of chemotherapy in a treatment regimen. Here's another interesting case. This individual was on hospice and basically bedridden. So the expectation was that he was not going to live very long. And a family member had contacted us and said, look, this is my godfather, and he's very important to me, and he's a very strong man years ago, and now just seeing him wither away like this, I just want to see if there's anything that could be done. So we reviewed the case, and this individual had cancer all over their body, and there was no evidence that, I don't have any data that shows at the level of disease that he was at, that something could be done to eliminate all of that cancer. But what we did have is data that we could get him out of bed and walking, and we could have a dramatic increase in his quality of life to a point that he could live like as if he doesn't have cancer until the day he passes away. So we put together an exercise program for him, and he wound up getting so much stronger that he was able to walk for miles, and he actually went hunting 6 times over about maybe 8-month period or so. And during that time, he carried his rifle for miles. And this was a guy, remember, that was bedridden and couldn't get out of bed, and now he's going out hunting with his friends. He did eventually pass away. It was very sad because he was a very likable individual. Everyone loved this guy, even friends that he hadn't seen in years. He just had that kind of ability to just, he was very likable. People just would latch onto him right away. And when he had passed away, the family had thanked us that, we gave him a quality of life that everyone thought there's no way he would ever be able to do these things again. And one of his dreams was he always wanted to go hunting one more time. And we were able to help him go hunting 6 more times. So the family was very appreciative of that. And so the point I wanted to make is even someone that is really advanced with their disease progression, we could use exercise to dramatically improve their quality of life, so they're not spending their last days suffering in a hospital where they may be over-medicated and not recognizing their loved ones. His last days, he was out hunting, he went out on a date, went dancing, things that normal people would expect to do in their lives. And you wouldn't know, like if you looked at him, there might be, he didn't look like he was dying of cancer, is my point. This next slide just shows you that his natural killer cells had increased, just like his cytotoxic T lymphocytes. And then here what I have is a slide that shows you over 8 weeks. The main point I would like to make with this slide is that if you notice, his natural killer cells were able to improve quite a bit more than his cytotoxic T lymphocytes. He did get some improvement in his cytotoxic T lymphocytes, like if you look at early on versus later, but he didn't get as much of an improvement in the cytotoxic T lymphocytes as the natural killer cells. This individual is on a lot of chemotherapy. Over the course of his care, he got enough chemotherapy that the expectation is that his immune cells would be gone. But we were able to show that we were able to get pretty significant improvements. We more than doubled some of his counts. The one finding, though, that we learned by the time we had worked with this individual is that the people that were able to get their immune counts higher over a certain threshold, those people actually beat cancer and they don't get cancer again. For the patients that were not able to get as high, those patients do wind up dying. And so we were able to develop an algorithm where we could show that exercising at a certain amount for a certain number of days per week could help people get to those threshold levels that are critical for making sure that they survive the disease and they beat it. This next slide, this is an individual that has advanced osteoarthritis but no cancer. And what I wanted to show is that in healthy people and in people with osteoarthritis that's pretty advanced and in patients with cancer, we can still get significant improvements in immune parameters. One of the other things that came out of this is that we also introduced resistance training. And by this point, we now learn that resistance exercise without, just breathing in room air and exercising with oxygen, so pedaling on elliptical while breathing in 86 to 93% pure oxygen, both of those dramatically stimulate natural killer cells and cytotoxic T lymphocytes. We've now progressed our exercise model where we have patients working out 2 to 3 times a day, and we're spiking these cells that fight cancer. So we're spiking the immune cells that fight cancer, and we're leveraging this. We've now come to a conclusion that people need to exercise about 90 minutes a day once they have cancer to really get their immune system strong enough to actually fight and beat cancer. That's something that very few people know. Most people are told, just to exercise, but not giving specific details about when and how and what to do. And here we have some data on a male with a bladder cancer, and what I want you to see is his immune parameters improve as well. And so the take-home message, at this point is that we've learned quite a bit. And what we have now learned is that cancer patients have significantly lower cytotoxic T lymphocytes and natural killer cells versus non-cancer patients. These cytotoxic T lymphocytes and natural killer cell values can be increased in cancer patients both acutely and chronically. So we can increase it the first 15 minutes of exercise. So the first time you exercise, you can actually make an impact. And I will say that selecting the appropriate forms of exercise is important, and that's why you need someone that is competent and understands the relationship between exercise, the immune system, and fighting cancer. Now these findings, they apply to patients with solid tumor type cancers and also to patients with blood type cancers. So essentially what I'm saying is it doesn't matter what type of cancer you have, there appears to be a benefit of exercising to stimulate immune parameters in a favorable direction to fight the cancer. One of the things that we learned that I have yet to see any center in the world communicate to their patients is when patients are frail or weak, they actually need to exercise in a hypoxic environment. That means low oxygen to help get their muscle mass back more quickly. But in terms of stimulating your immune system, improving brain function, reducing pain, or improving bone or immune parameters, these require more oxygen or hyperoxia. And so that distinction between when to use low oxygen with exercise and when to use high oxygen with exercise, we've tested enough people to really figure that out and really dial it in for patients to make the results faster and easier. I don't know any other center in the world right now that has things figured out to that level of detail. Our future research projects are looking at doing IV therapy, so different treatments while patients are exercising. I have some theories right now that I think we can enhance natural killer cells and cytotoxic T lymphocytes even further. And one of the things that sort of is my big pet peeve is I watch all these patients spending all kinds of money on immune therapy and traveling all over the world to do these alleged immunotherapies to stimulate their immune system. And what I showed you here is the first actual data that blows away everything else I've seen so far. I've yet to find a drug or a supplement or an immune therapy protocol that is better than the results I showed here. And one of the benefits about what I'm sharing with you now is once you come to our center and learn how to do this, you could do this at home. This is not something that you need a physician to even do. And the other thing that's really important is that while you're simultaneously improving your immune function, you're also getting more fit, you're getting stronger, you're improving your brain, you're reducing joint pain. So there's numerous other benefits. And we're actually in a process right now is we're going to start collecting more data on senescent immune cells, and we'll be connecting data on the telomere length of various immune cells. So essentially, like, we'll be doing the same exercise with oxygen therapy and resistance training programs, but now we'll be collecting data on other parameters that have not been measured previously. And what my speculation is that we're going to see some unique findings, and from those unique findings, we'll be able to better micromanage the exercise process to really help people get significant better outcomes. Now, for anyone that's really interested in this type of research where we're actually making positive impacts immediately on someone's life, we have some ideas about doing research where we'll be exercising people in what I would call like environmental chambers. And so if anyone's interested in funding that research, I encourage you to contact me through our website at causenta.com and just fill out a form and say, hey, I'm interested in being part of some outstanding research. And so, like, kind of give you an example. Imagine if we build a chamber, and in that chamber we can control the partial pressure of different gases, and we can control relative humidity and other variables of the environment, and then have someone exercise in that environment. We think that we can make some pretty impressive results that we're getting right now even better with this type of environmental control. So I hope you found this presentation interesting. I hope you learned a lot about how exercise can boost immune function in a way that can help you fight cancer. And if you're ever curious, we invite you to come down into our facility and see firsthand the results that our patients are getting. We now have patients coming from around the world to experience these results. And typically, once one person comes and they see firsthand what happens, they're sending their entire family to us, even people that don't have cancer, because they're marveling at how they can get so strong and get so fit at the same time that they're fighting cancer and reducing the burden of the disease on their body. Thanks again.